Methodological recommendations for the treatment of hand of employees of medical organizations of the Republic of Kazakhstan. There are 3 ways of treating the hands of employees of medical organizations. First, hand washing with soap and water without the use of antiseptics. Second, hand treatment with antiseptic. Third, surgical disinfection of hands. Hand washing with soap and water without the use of. Hand washing with soap and water without the use of antiseptics is carried out in the following cases. First, before working with food, cooking and distributing food. Second, before eating. Third, after visiting the toilet. Fourth, before and after taking care of the patient, when there is no direct contact with the patient. Change of bed lining, cleaning of the room. Fifth, after contact with the patient's intact skin. Palpation, pulse measurement, blood pressure, except for patient with sign of infection and parasitic disease. Sixth, in all cases where the hands are clear dirty. Okay, next page. Warm running water, liquid soap in bottles with a dispenser, disposable towels or disposable napkins are used for hand washing. Do not add liquid soap to a partially emptied bottle. The sequence of action when washing hands. First, open the water tap. Second, moisten your hands with water. Third, apply soap on wet hands. Carry out processing in accordance with the European standard EN-1500 appendix to the guidelines. Fifth, dry your hands with disposable towel or a disposable napkin. Sixth, dump the towel into a container or waste collection container. Okay, hand treatment with antiseptic. Hand treatment with the use of antiseptic is carried out in the following cases. First, before and after performing invasive procedures. Second, before and after manipulations with damage to the integrity of the patient's skin. Third, before and after manipulations with wound and catheters. Fourth, after contact with blood and other biological fluids, secretion of the patient. 5. Before and after contact with patient with signs of infections and parasitic disease. 6. Before the examination of newborns. Okay, hand sanitizing consists of 2 steps. Washing hand with soap and water and disinfecting hand with a skin antiseptic. The sequence of actions when processing hands using an antiseptic. Wash hands with soap and water in accordance with paragraph 8 of these guidelines. Second, apply an antiseptic on the hands in an amount of at least 3 milliliters and carefully rub into the skin until completely dry, following the sequence of movements according to the EN-1500 standard. Do not wipe your hands after applying the antiseptic. Hands are treated with warm running water, liquid soap and antiseptics in bottle with an elbow dispenser, disposable towels or disposable wipes. Do not add liquid soap and antiseptic to a partially empty bottle. Surgical hand disinfection. Surgical hand disinfection is performed in the following cases. First, before any surgical interventions. Second, before serious invasive procedures, for example, puncture of large vessels. Okay, stage of surgical hand disinfection. This is algorithm. Okay, processing steps. First, mechanical hand cleaning. What it mean? Wash hands and forearms with water and liquid soap, strictly following the sequence of movement according to the EN-1500 standards. Dry with a sterile towel or sterile napkin. Okay, we need for this situation we need 2 minutes. Okay, second, hand disinfection with skin antiseptic. Apply an antiseptic on the hands and forearms in portions of 3 milliliters from the elbow dispenser. Consumption for one treatment 10 milliliters. Rub the antiseptic into the skin of the hand, strictly following the sequence of movements according to the EN-1500 standards. And this is second step. We need 5 minutes. Okay, third, put on sterile gloves on your hands after the antiseptic has completely evaporated. Okay, next page. Okay, the sequence of movements when processing hands according to the European standard EN-1500 or 1500 European standards. Okay, first steps: rub on palm against other palm in reciprocating motion. Second step: rub the back surface of the left hand with the right palm. Change hands. Third steps: connect the fingers of one hand in the interdigital spaces of the other. Rub the inner surfaces of the fingers with up and down movements. Okay, fourth, connect the fingers in lock. Rub the palm of the other hand with the back of the bent fingers. Fifth, grab the base of the thumb of the left hand between the thumb and the forefingers of the right hand. Rotation, friction, repeat on the wrist. Change hands. In a circular motion, rub the palm of the left hand with the fingertips of the right hand. Change hand. Next page. Each movement is repeated at least 5 times. Okay, we need one steps. We need each movement is repeated at least 5 times. Hand treatment is carried out within 30 seconds and 1 minute. After completing work, remove gloves, wash hands with water and a liquid soap, and apply a nourishing cream or lotion to prevent a drying effect. Okay, we are looking this dispenser, soap, antiseptics. Next, after completing work, remove gloves, wash hand with water and liquid soap, and apply a nourishing cream or lotion to prevent a drying effect. Hand hygiene. The most important measure to help limit the spread of many diseases. Most intestinal infection, purulent septic infection, viral hepatitis, and even influenza are transmitted through the hands. The consequences can be complications in the form of chronic disease and even death. Hand hygiene. The only and most important thing we can to avoid catching any disease and not spreading the infection is to wash our hands. 30% of all infections are transmitted through undisinfected hands. Not forget, this is very more important. Future doctors. Okay, next, hand hygiene. Healthcare workers practice hand hygiene on average less than 40% of the time, leading to infection among patients. In the intensive care unit, doctors wash their hands 28 times out of 100 times they are required to do so. Nurses wash their hands 43 times out of 100 times they are required to do so. In 1981 years, a Seattle University hospital study that included more than 200 hours of observation showed the hand washing was observed at only 30% of the ideal level in individual boxes and 16% in open intensive care unit. Reasons for non-compliance with hygiene rules. 61% forgetfulness. 36-39% lack of time. 15-30% skin problems. 11% insufficient awareness of the problem. 50-85% emergency situation. 42% lack of knowledge. Remember, future doctors, if you do not wash your hands, you will harm the patient, in fact, or in the worst case, there will be mortality. Factors contributing to poor hand hygiene practice as reported by health workers themselves. Hand washing products cause irritation and dryness. Washes are inconveniently located. They are not enough sinks. Lack of soft towels. Often too busy. Lack of time. Understaffing, overcrowding of the department. First of all, attention should be paid to patients. Low risk of infection from the patient. Wearing gloves. The belief that it is not necessary to wash your hand when wearing gloves. Insufficient knowledge of instructions. Don't think about it, forget it. No positive example from peers of management. Skeptical attitude. Disagreement with recommendations, lack of scientific information, and positive association between meticulous hand hygiene and nosocomial infection. An important measure to prevent. First, self-infection through the nose, mouth, or conjunctiva. Second, transfer of microorganisms to the environment. Third, transmission of microorganisms to other patients through contaminated hands. Hand hygiene. The frequency of contamination of the hand of nurse. In the analysis of 1247 hand cleaning procedures among nurses, it was noted that 464 it means 37% of them were touched with contaminated hands. Your eyes, ears, nose, teeth, mouth. Remember, medical students will save a thousand lives in the future. Your mission is very important. Don't forget me, it's me. Bye.